presentation I'm going to give you today is going to talk about specifically like Diabetes 101, just some really generic information about diabetes, medical emergencies of diabetes, and then insulin pump management, and really what your role would be with somebody who comes in with a pump. So what is diabetes? I think all of us might know someone with diabetes these days. It's a pretty prevalent condition, but it's a chronic disease, which means it doesn't go away. So somebody who has a diagnosis of diabetes lives with this chronic condition for the rest of their lives, and it's something that they have to manage. And it's where the body can't utilize glucose normally as fuel due to the lack of insulin that's produced by the pancreas, or the pancreas no longer produces insulin. All right. The pancreas is an organ in the body. It's located next to the stomach. Actually, 1% of the job of the pancreas is to make insulin. So when you think about it, it's kind of a defeated organ when we start out, right? It doesn't have a lot of hope in terms of the amount of people that have diabetes, I'll say. But insulin's a hormone. It's produced by the pancreas, and there's different kinds of diabetes diagnoses out there. There's type 1 diabetes. There's type 2 diabetes, there's latent autoimmune disorder, or what we call LADA, there's gestational diabetes, there's pre-diabetes, and I'm going to talk more in depth about those going forward. So just the prevalence, I know the statistics I'm giving in this slide are from 2012, and we're a few years beyond that now, but the diabetes diagnoses are on the rise. Even from 2012 till now, there's 86 million Americans that have a diagnosis of prediabetes, which means they don't yet have a diagnosis of diabetes, but they're in a condition where their blood sugars are not normal, but not yet diagnosable to be called diabetes. When you think about this number, 86 million, this is the population of Australia. So that's a lot of people when you think about that. It's really the 7th leading cause of death in America. As of 2010. However, it's not listed as number 1 on a death certificate, but it could be the cause of the number 1 cause of death on a death certificate. So you have to think about that this is a very insidious condition that causes a lot of other things like heart attacks and stroke, which are more to the top of a leading cause of death. 29.1 million Americans, or 9.3% of the population, have diabetes. 8.1 million% are undiagnosed, and the 21 million that are diagnosed, about 93% of them have type 2 diabetes. So a very small percentage have type 1 diabetes. We're going to again go through what those are. So here's the percentages and prevalence of type 1 and type 2. You can see even from the early 50s going forward, it's all on the rise. I would say causes of this are genetic, environmental, lifestyle. All those things are contributing to why there's an increase in diabetes in our culture these days. As I mentioned, 93% of all diabetes is type 2 diabetes. So these are the different types. So I was talking about type 1. Again, that's a smaller percentage of the total number of people who have it. What type 1 diabetes is, it's an autoimmune condition. So that's where the body attacks itself. Those small cells on the pancreas, the beta cells, are destroyed in a condition of type 1 diabetes. This usually occurs in children. We used to call it juvenile diabetes. Now, young adults can be diagnosed with type 1 as well. It's where the body no longer produces insulin, and it requires routine insulin injections or an insulin pump to deliver the insulin. And without insulin, the person could die. So that's why it's important that this diagnosis is recognized and treated. This LADA, or LADA, is the latent autoimmune disorder of an adult, and that is also like a type 1 diagnosis. People at any age beyond their childhood could be diagnosed with a LADA diagnosis. Often, again, it's genetic, so it runs in families. Type 2 diabetes is the condition where, again, if you know somebody with diabetes, they may have type 2 diabetes because it's more prevalent, but this is where the body produces smaller amounts of insulin. I usually call it like grade B insulin. It's not the best insulin because it's not doing the job designed to do. It's also acquainted with, or associated with insulin resistance, where the body doesn't or requires more insulin to get the job done. What insulin does is it moves glucose into the cell to be used for fuel instead of leaving all the glucose in the bloodstream. So when you have insulin resistance, you just need more insulin to make sure that the glucose gets into the cell. It usually develops later in life. It's usually a lifestyle situation where sometimes people may carry extra weight in the front of their body that can cause insulin resistance to occur. It also is a genetic link to that. Many use diet and exercise to help to get their blood sugars down, but many also require medication, which in a type 2 setting, there's pills and other injectable medications that people can take, and also many people do take insulin that have type 2 diabetes. Gestational diabetes is also another type of diabetes that occurs during pregnancy. It does resolve after the delivery of a child. However, it does put that person at greater risk for developing diabetes later on. So how does insulin work in your body? Again, I mentioned it's produced by the pancreas, and it's a hormone, and it's designed to take glucose into the cells where it's needed for fuel. So when we eat our food and our food turns to glucose, meaning carbohydrates turn to glucose, that glucose is really important in keeping our bodies nourished. So it moves glucose into the cells so that the cells can be fueled, and that it keeps our pancreas keeps our body at a certain target blood sugar every day by our own homeostasis, unless you start to develop diabetes. And what's important too to note here is that our brains function on glucose. So if we don't have normal glucose levels, if glucose levels are too low, you can't think clearly. If glucose levels are too high, you can't think clearly. So it's important to have that homeostasis. So what's the responsibility of the person who has diabetes? So when the diagnosis happens, the person who is diagnosed really, at times, this is like a full-time job for them. They have to monitor their blood sugars daily, usually multiple times in the day. They have to meal plan. They have to know what they're eating because they know that the food that they eat can affect their glucose levels. Often they are instructed to carb count or count carbohydrates, read nutrition facts labels. Activity is a giant part of what they should be doing. So that would be exercise or anything active. And then managing high and low blood sugars, hyper and hypoglycemia, and routine medical care. Usually they see the doctor about 4 times a year. So meal planning is important because it's the carbohydrate portion of our meal that converts to glucose. And this is really where people with diabetes are keeping a close eye on the amount of carbohydrates that they eat. This is really the primary fuel source for our cells because that's what converts to glucose. The other components of our meals are protein and fat. So protein and fat are really, really important aspects of our diet too, but having a good balance of these items is what's going to keep us all healthy. So I often talk with people who say they're on specific kinds of diets. There's diets that are higher in protein and have less carbohydrate. They may not be the healthiest diets for us to be on. They might jumpstart patients' weight loss program, for example, but this is definitely a balance of this is what's best for all of us to maintain our health, to maintain our weight, etc. And for patients with diabetes to keep in good glucose control. So again, I mentioned type 1 diabetes, you need insulin to live. So what a insulin pump does, and what I'm going to be talking about here in a minute, is how we want to mimic how normal healthy pancreas would work. So in this little demonstration here, and for patients who have type 1 diabetes requiring insulin, as their blood sugar levels rise, they need to take insulin to maintain a good balance. So they take a long-acting insulin, and that's what this green line is showing here. That one injection that they would take if they were taking shots would keep a balance through the day in the long-acting aspect. And then every time they eat or they have a surge of glucose rise from a meal, they have to take an injection to help keep that glucose spike down. All right. So what this pattern is really doing or mimicking, it's trying to act like a healthy pancreas would be. Right? So a healthy pancreas gives little squirts of insulin all day, and it gives a big squirt when we eat. So people with diabetes who require insulin are trying to mimic that by doing this. So an insulin pump is it's a more sophisticated way to do that. So an insulin pump infuses rapid-acting insulin, and there's different types of insulin, and I'll stress that it only uses rapid-acting. That would be the only insulin that the person uses when they use an insulin pump. And the pump is programmed to the individual patient. So when they meet with their physician, the doctor decides, or nurse practitioner or PA decides what the settings will be in their pump based on how much insulin they need. It's delivered through a small cannula. So the patient inserts this little cannula device. It's like a little tiny tube that sits right underneath their skin, and it pumps insulin through that little tube all day. And when they take a larger amount for food coverage, it gives a larger amount through that same space. So they just have this one site on that they wear, and it just sits right underneath the skin. This replaces injections. So an insulin pump took the place of those multiple shots that somebody would have to take during the course of a day. And then the patient who wears this manages their blood sugar control and the settings in the pump with their provider. All right, but it's really the closest thing we have nowadays to how a healthy pancreas would work is an insulin pump device. So when patients put this on or wear this, there's different sites where they can have this infusion set, we call it, and it can be in the same places that we instruct patients to take an injection of insulin. So on the body, that would be the abdomen, the top of the legs, the back of the arm, the back of the hip, and the side of the thighs. So these are all spaces where injections can go if a person's using a syringe, but it can also be a place where you put an insulin pump site. So this is just a picture of what an infusion set looks like when it's on the skin. So it's a little flexible tube, it's plastic, and it's just inserted with a needle. The needle comes out, it just leaves behind the little plastic cannula, and then it just slowly drips. I call it drip irrigation, right? So it's just dripping, dripping, dripping all day into this liquid. I call it adipose tissue or fatty layer underneath the skin. Oops. And consistently gives them an amount of insulin through the day. So the client here who's wearing the insulin pump, this is what she experiences. She wears this infusion set. This infusion set is changed every 3 days along with the insulin that you put in the pump. So she's doing what we call an infusion set change every 3 days. Right. So an insulin pump, sort of like using a syringe, it's delivering in two ways. So it's programmed to deliver basal insulin and bolus insulin. So basal, I like to kind of keep these words simple in your mind as you are maybe hearing them for the first time. But when it's programmed for basal, that's the base dose. And that is the tiny amount that's being delivered all day long. So think of that as the base. And with a normal healthy pancreas, we're doing that all day long. We're giving a little base dose on our own, right, for people that don't have diabetes. A bolus amount is a larger amount. And the way I have people remember this, if bolus, think of a bowl, like you're eating from a bowl. So a bolus dose is when you're covering for food, or if your blood sugar is high and you want to fix that high number and bring it back down to a target range. For most people, they're targeting 100 to 140 in their pumps to target, to do the math on this little special calculator, by giving a bolus to get their number down. So the pump uses rapid-acting insulin, and again, just to be really clear, there's lots of different insulins out there. Some of them are really slow-acting so that they can create this kind of little drip that we would need all day. So for some people, if they take injections, it's 1 shot a day that lasts 24 hours. But this pump uses rapid-acting insulin. So it's an insulin that works in about a 3 to 4 hour window of time. So when you take it, it goes in and goes out of your body in that period of time. So when you're just using rapid-acting insulin in the pump and programming the pump, it's going to deliver that little tiny dose that's going to copy what a long-acting shot would be, but then giving you the ability to take a rapid-acting injection or bolus if you eat something or correct a high. It just provides less variability and is just more consistent than a long-acting insulin in terms of the variability piece of it. Pumps have a really accurate insulin delivery system because it's really customized to the person. Everybody's pump is programmed differently based on what they need. And our pumps use a bolus wizard calculator. Think of all pumps as calculators. Basically, when a patient gets a pump, it's programmed to them specifically for what they need. And there's the calculator portion of this pump that's designed to give them the right amount when they're eating based on their settings. The nice thing about a pump too is it tracks insulin that you've given. We call that active insulin. And when you're tracking that, there's less likelihood of taking too much insulin at one time, which could cause low blood sugar. So as I mentioned, the Bolus Wizard is a calculator. It calculates for food and correction boluses for the patient. A correction is fixing a high sugar or correcting it. It tracks the active insulin from any previous bolus amounts so that you're not taking too much insulin at once. We call that stacking insulin or stacking the power. It uses your personal settings. And then these would be what the Bolus Wizard settings are in here. The responsibility of the person wearing the pump are listed here. And I think this is important for everyone to see because it's not the responsibility necessarily of the personnel in the facility here to be managing this pump, right? It's the person who wears the pump's responsibility. So the responsibility of the pump is for the person who's wearing it. They need to know what they're doing. The pump will alert the person if they're getting low on insulin or if the battery's going low and they need to change it. So they're going to get alerted in any of that situation.
Quick question. When it does alert, what is the note? How do we know it's alerting them if it's too low, or is there a specific beeping sound?
There's going to be a beep.
Okay.
Yep, the pump will beep.
Because I've noticed before on a different occasion with the client, it was beeping, and we didn't know if it was because of the way the tube was, because sometimes it gets twirled, or because we noticed once we moved the pump up higher, it wasn't doing that.
Okay, yeah.
So I don't know if that's like meaning the battery's low or if
Yeah, so that's a good comment. It could be that maybe the delivery of the insulin wasn't going in, so there was a no delivery alert that came up.
Okay.
So if there was a kink in the tubing or the piston in the pump that delivers or pushes the insulin from the little reservoir that's filled and inside the pump wasn't able to move, she would have gotten that alert.
Okay.
Yeah.
Okay, so then it just maybe the cord.
Yeah, I think the big message here is to pay attention to any alerts. Again, that's the responsibility of the person wearing the pump, but if you hear it consistently, you want to ask what's happening. Why is that making that sound? They should always have backup supplies on hand. Again, being the responsibility of the patient, it's not the responsibility of the center. They should be carrying some kind of emergency kit with them so that they have a backup plan. They are responsible for testing their blood sugar so they know where they are at all times, or have the ability to know where their blood sugar is at all times. And the responsibility of them as well is to carry what they need for any low blood sugar or high blood sugar situation, and we're going to talk about what that is now. So any person who has diabetes and takes medication, specifically I'll say, is at risk for high or low blood sugar. All right. So hyperglycemia, and we're going to talk about really these in terms of what is an emergency in terms of these. Hyperglycemia is high blood sugar, so that's defined as any blood sugar higher than 250, and it occurs when the body doesn't have enough insulin to get the glucose into the cells. And hypoglycemia is low blood sugar, and that's defined as a blood sugar less than 70, and it occurs when the body doesn't have enough glucose to use as fuel. So what to do if your blood sugar is running high? I gave you guys some pictorials, but here's some little cartoon faces. It kind of makes it easier to understand what symptoms of high blood sugar would be. So thirst is a big one. People with high blood sugar are really thirsty. They're often hungry. They are weak, sometimes fatigued or sleepy. They may have blurred vision and the blurred vision can come on quickly. Maybe yesterday they were fine, but today they can't read a road sign or read well because their blood sugar's high. You can have itchy, dry skin. The high blood sugar is also a problem for sores that don't heal or wounds that don't heal. Urinating often is a sign of high blood sugar, as well as nausea. So people want to test their blood sugar to see how high it is if they have any of these symptoms. If it's greater than 250 and not coming down, people with diabetes are instructed to test for ketones. And ketones are a waste product of fat metabolism. So when you're burning fat, it's going to produce something called ketone. And ketones are high, when they're high in your bloodstream, they can become very dangerous. They actually make blood very acidic, which isn't a good place to be. So if you have too many ketones in the body and you're not addressing this situation, it could actually turn deadly for the person. You'll know as you move through somebody who has high ketones, they're often nauseous. They can't keep food down. They're vomiting. So somebody with high blood sugar who's nauseous and vomiting maybe has checked for ketones and they're running even trace to small to moderate, they should go to the emergency room. It's a medical emergency. So what to do if blood sugars are running low? This is hypo or low glycemia, hypoglycemia, defined as when a blood sugar is less than 70. However, some people who run higher numbers, say if they're accustomed to running 200 because their blood sugars are just not well controlled, they might experience hypoglycemia when their blood sugar is 100 or 110. They might have these symptoms of low blood sugar, which is shaking and sweating and feeling dizzy and anxious. They might have blurred vision as well. They might feel fatigued. They might have a headache. They might be irritable. You can see some of these symptoms here are just like symptoms on a high blood sugar. So it's really important when a person is not acting like themselves to ask them to please check their sugar to see where they're at. And it's for safety. Okay. So treatment for low blood sugar, generally I put glucose tablets at the top of the screen because they're easy to measure out in terms of what a treatment would be for a person. And it's generally 3 to 4 glucose tablets is a good treatment for somebody who's having a low or feeling low, even if they're not technically low. But they want to check their sugar. If they're less than 70, and again, I'll say if they're having symptoms and they're 100 or 110, you want them to take the edge off in that regard, or bring their sugar up if they're lower than 70. So they want to get sugar in their body. You don't want to be giving them insulin, right? You want to give that sugar time to work. So you want to wait at least 15 minutes before they check their sugar again to see that they've come up. Okay. If it's still less than 70, about 15 minutes later, you want to have them take some more sugar. You can kind of see here with this little protocol that it's being careful how you treat a low. You don't want to have somebody eat a couple donuts to get their blood sugar up and not take insulin to cover part of that because they're going to go too high in a situation like that. So you're really kind of keeping it at a measured amount of glucose that they're using to get their blood sugar back into a space that's not too low or uncomfortable. So here the suggestions are cheese and crackers, half a sandwich. I think a rapid acting, and this is after, say, treating a low, you want them to have a snack. My recommendation would be to cover that snack with some insulin, get their body kind of back into feeling okay. If somebody is sleeping, I like this slide, and they're not waking up or they're unconscious, don't try to figure out how to get their blood sugar up independently. I would call 911 and start to get assistance immediately. So some strategies to help with hypoglycemia is there is something called glucagon, and it's prescribed by the doctor. I know at the Moore Center in particular, one of the concerns was that the nursing staff was not going to be delivering this. However, this is, I want you to really think about this like an EpiPen. All right, so if somebody was having an allergic reaction, you wouldn't let them choke and die. This is the same thing. This is like an EpiPen, but it's for people with diabetes who have low blood sugar. So if you had this available, and I believe most clients carry them with them if they have type 1 diabetes, I maybe would ask. I would do my best if you saw this. You're not going to get in trouble. You're going to be a hero for saving them if you actually gave this medication. The instructions are right inside the lid of most of these items, so you don't necessarily even have to know what you're doing. You can open it up and it gives you the instructions in there on how to deliver this. Instructions are online as well. You want to check too especially for somebody who's wearing an insulin pump, make sure that their pump is on correctly, make sure that they're using good technique, they don't have infections at their site, make sure that their sites are connected, especially if they're going high. Hypertrophy is a condition where if you take too much insulin in one space, it actually develops fatty scarring. So if somebody puts a site in the same place all the time and not rotate that site around, they could have issues with running higher than normal blood sugars. So just something to know, good to know. And then with hyperglycemia and or development of DKA, which is diabetic ketoacidosis, you want to make sure that patients monitor their blood sugar to prevent those situations. And checking blood sugar, ideally, most doctors' offices and protocols would recommend 3 to 4 tests a day. All right. Some people test more. Again, so here's what to know. I'm just going to kind of recap diabetes emergency, what to know and what's important to keep on hand. When I say keep on hand, this is something that the Moore Center might consider just as your own personal emergency kit. Again, my message is more that patients should have their own emergency kits available. They should be carrying their own supplies. They're instructed to do so with this diagnosis when they go on pump therapy, when they learn about how to manage diabetes. But to have something available on site is also helpful for you all. But hypoglycemia, again, it's low blood sugar. It's a blood sugar less than 70, or somebody that might have symptoms of low blood sugar but are higher than 70. You never want to give an unconscious person some liquid or food because they can't swallow it. Don't ever put anything in their mouth. They could aspirate, which could lead to another problem, right? You don't want anybody choking. Don't give them insulin. So a person who has a low blood sugar actually needs sugar to go move their blood sugar up, not insulin, because that would bring them lower. So you want to kind of keep it at 15 to 20 grams. Again, a small package of crackers, 3 to 4 glucose tablets. On some of the handouts I gave you, it gives you some good ideas about what to use for treatment. But anything that's carbohydrate will raise the sugar up. Make sure that their glucose is rising by checking their finger stick blood sugar about 15 minutes after they get a treatment. And once the person's up to a normal range, you want to make sure they get a small snack. So keeping small snacks, glucose tablets, juice boxes, crackers, candy, those are all kind of handy small things that could be around that would be used in an emergency. It doesn't have to be any special medicine. The food is the medicine in this regard. And then the glucagon kit we talked about is an injection for somebody who has hypoglycemia. What to do if the person's got hyperglycemia or high blood sugar. Again, this is a blood sugar greater than 240 to 250, and they're not coming down with insulin dosing. Again, this can develop over a longer period of time than a low blood sugar would, but this could happen in as short a time as 3 hours if they go into this DKA or diabetic ketoacidosis state. The person needs insulin to bring their blood sugar down, and they should be drinking plenty of water. Non-calorie beverage. So I know a lot of people that don't want to drink water, but as long as it's a non-calorie beverage, preferably not like a cola beverage, but something with non-bubbles is best. You want to check blood sugar to make sure that they're responding, make sure that they're coming down over the course of an hour, 2 hour, 3 hour. If they're having stomach pain, vomiting, or can't keep fluids in, and can't keep anything down, they need to go to the emergency room. Okay. So in terms of insulin pump therapy, it's really definitely more accurate than injections, which is why if you have a client who's using a pump, that's a tremendous thing. I think it's important that they feel empowered by having this pump on. It's actually going to work better for them than injections in the long run. It mimics more what they need in terms of how it's programmed. And really, it helps with large swings in blood sugars.